We'll wait just for a moment to see who all joins. If you are starting to join, I hope that you are having a great Friday, or as great of a Friday as you could possibly have, given the circumstances that we are facing as a country. Wanted to provide an update. It's been a little while, a few days since we did one of these. We did one on Monday. I had planned on not doing another until Monday and essentially doing one every Monday as a podcast. But there's been enough that's happened in the last few days, particularly with President Trump announcing some guidelines for how to reopen business. I thought that it was pretty important to go ahead and get out there and maybe talk to folks a little bit about what's going on and what they can expect in the coming days and weeks across the country. It's going to look very differently depending on what part of the country you are in. In the future, we will do these at another page. So if you're a friend of mine or a family member on Facebook, my personal page, you should have gotten an invitation to join a group called Focused Policy. It's a new endeavor that I'm undertaking. The podcast will be sort of issued out of that Focused Policy page moving forward. So if you haven't liked that page yet, please do like that page because that's where we'll be doing these Facebook Lives moving forward after today. So wanted to talk through a few things. Thanks, Frank. I appreciate you. Wanted to talk through a few things today to try and get things caught up a little bit and then talk about what it's going to look like to reopen the economy. Just start with some very, very basic numbers for everybody's awareness, sort of as we have context going through this. Globally today, we've got 2.2 million confirmed cases of the novel strain of coronavirus that causes COVID-19. And we've had 147,000 deaths, give or take, which is obviously remarkably high. I mean, the loss of life here is very, very tragic. China actually revised its death toll up by 50% today. Not that anybody was really trusting what China was doing before now, but if anything, this is just further confirmation that the data coming out of China up until now has been bad. There's clearly been some concerted effort to hide what's happening in the country. There's a lot of speculation and rumor about how this thing actually originated at this point, with some really credible voices that are actually pointing to the idea that perhaps it didn't originate in a wet market, but that sort of became a scapegoat. That's neither here nor there. All that's pretty speculative at this point. But we know just from looking at what China has said and done publicly now that they actually just haven't been very reliable in the information that's coming out. U.S. cases, we've got 662,000 cases to date, about 28,998 deaths. One of the figures that hasn't been reported pretty very widely is that we've had 54,000 recoveries during this period of time. And so we're starting to see the recoveries start to seriously outpace what we see in terms of daily cases and deaths. And that's a really positive thing to see the sort of that curve being bent a little bit. Now, I'll mention that it will be misleading for the next few weeks because you're going to see a spike in the number of reported cases. You're going to see a spike in the number of reported deaths. That isn't because the situation is getting worse in the country. It is because the Center for Disease Control, the CDC, has decided to change the way that it is counting cases and deaths. So there was already a decent amount of criticism around the way that the CDC was handling particularly attributed deaths. And there have been people sort of in the conservative circles who have said there have been too many people having their deaths attributed to COVID-19 who ultimately died for some other reason. But up until now, the way that the CDC was essentially doing this is the CDC would only use as confirmed cases laboratory confirmed cases. So somebody that had the swab test in their mouth, their nose, the strain of coronavirus was there. That's a laboratory confirmed case. And then only the deaths that would count as COVID-19 deaths were people that had had laboratory confirmed cases. Now, you could quibble about whether or not those people really died from some comorbidity or the coronavirus, but that at least was a reasonable way to look at it. What the CDC is now saying is we actually think that we're dramatically undercounting the number of cases. We think we're undercounting the number of deaths associated with this for a lot of reasons. One, there are people who were asymptomatic, people who had mild symptoms, never got tested, never felt sick enough to get tested. Obviously, those people aren't being counted in. And then you've got people who probably would want it to get tested, but early on the testing protocol wasn't designed to be able to keep up. And so there were people who were sick who weren't able to get tested, and people who are coming into clinics and things like that that just haven't been tested, but that appear with the symptoms. So what the CDC is saying is we're now also going to count probable cases and probable deaths. Those are cases where diagnostic or clinical determinations are made, not necessarily the lab testing. So you're going to see spikes in the numbers that are reported, both in terms of confirmed cases and in terms of deaths. The truth is that some of this debate is irrelevant to the larger picture. Ultimately, we're not going to know until a considerable period down the line how many deaths actually are attributable to COVID-19, how many cases there really were, and to some degree, those things will always be estimates. But the reason I say we won't know around deaths is, a year from now, we'll be able to see what hospital admissions look like during this period versus other periods and times. We'll be able to compare the data from this period of time to historical periods and to know, was there actually a dramatic spike in the number of hospital admissions? Was there actually a dramatic spike in deaths relative to other years? Or did we see categories that normally are much higher, heart disease, cancer, etc., actually fall back because it's being reported as COVID deaths? We don't know that now, and there's no real reason to quibble over it. That's something that we can look back on in the future and figure out. Why testing is important is to have a better sense of how big of a problem we currently have, how many people have been affected. We talked about on Monday, there are literally millions and millions and millions of people who probably have never been tested in the United States that in fact do have or have had the coronavirus, either in mild form or in asymptomatic form. So there are two different kinds of tests. We talked about the swab test a little bit. That's the one that tells you whether or not you've got it right now. And the United States is having essentially a very big number when it comes to positivity ratings. So the United States at first was doing a pretty poor job at testing. There were all sorts of mishaps with the CDC and some of the test kits that they sent out and not giving really good guidance to health agencies around how to use those test kits. They've improved dramatically. So over 3.4 million tests have been administered in the United States. That's more than 1% of the population. To give you a point of comparison, South Korea had been pointed to as being sort of a gold standard for testing, and they're right about 1% of their population that they've tested. So pound for pound, we've eclipsed what South Korea did, which was pretty laudable. But what we're finding is that the rate of positives that come back is about 20%. In South Korea, the rate of positives of all the testing that they did was about 2%. So about 20% of the tests that we're administering show that the person's got coronavirus. That could be an indicator of one of two things. One, it could be an indicator that our medical professionals are just phenomenal at determining who needs a test, or it can be an indicator of just how many people in the United States likely have the coronavirus or have had the coronavirus, and it's probably the latter. And so that's very consistent with what we've thought about how transmissible this virus is for a long time, and probably in terms of the sequencing from when we actually started intervening as a country to try and curb the spread of the coronavirus, that a lot of people got infected with this over time. It is notable that in the U.S., the hospitalization rate is lower than in other parts of the world. So the U.S. has about a 16% hospitalization rate. That had been higher. I think in China it was 19%. In other places it's been around 19, 20%. So that's an indicator of I guess, our system of care, that rate is slightly lower. And one thing notable about this is that the CDC's new data confirms what we talked about on Monday, which is that about 90% of all hospitalizations involve comorbidity. So it's people with diabetes, with hypertension, with heart disease, with cancer, with COPD, the kind of maladies that you would expect that would put someone at risk to begin with are largely being identified when people are being hospitalized. Not just hospitalized, but ultimately people who die are similarly showing comorbidities. Now, that doesn't mean that the comorbidity is the cause. It could very well be that COVID-19 compounded something that was already there and actually was the cause of death. But it's important when we're thinking about who's actually vulnerable, that vulnerable populations are overwhelmingly remain 65 plus and overwhelmingly remain people with comorbidities. The second test that we talked about was the importance of serological testing. And that test is not to identify whether or not you presently have the coronavirus or COVID-19, but to identify whether or not you have had it and your body effectively fought it off. The way that works is essentially They test to see if you have proteins or antibodies that built up in fighting off this virus, and they do that using confirmed cases. So we know in people that have recovered, this is what their bodies look like, this is what the antibody loads look like, and so we can use that to determine whether or not a person who didn't present with symptoms or didn't get tested at the time may have had it. Now, the problem with that is that it's pretty tricky. One, they just rolled this out starting March 30th, so the efficacy of these is not well established at this point. The other thing that's tricky about it is that antibodies with this virus tend not to show up for a couple of weeks, tend not to be at high enough levels that they are identified for a couple of weeks, and then they tend to fall off at some point. So you have a short window of time to identify whether or not someone has had it using serological testing. But obviously that could be valuable insofar as if we know how many people likely have had this, if we run the right kind of experiments to figure out how many people had it and weren't previously identified, then we can project onto the population what the total infection rate looks like. That also helps us to understand what the actual mortality rate is, because if you look at case fatality rates right now, they're relatively high. They're in that 5% range in the United States, but that's because we're only counting confirmed cases, people who got sick enough to be tested in the first place. And if there are millions of people that weren't, that drives that number up. So the serological testing could be particularly valuable. There are scientists who are saying that we need to get to the place that testing is out there at a sufficient level before we return to work. The problem with that is it's not clear that that's feasible. So why is it so important that we return to work? I mean, I think this one is obvious at this point. We talked about it at some great length on Monday, but a few more indicators that confirm what we already knew. The situation with our economy is pretty darn bad right now, and it's going to get worse. So the weekly jobless claims for this week, or the week that ended April 11th, were 5.2 million jobless claims. To give you some back picture, in 1982, we had a record of 682,000 in October. 1 week in 1982. That record stood until 4 weeks ago when there were 3.3 million jobless claims. The next week, about 6.7 million jobless claims. Week after that, about 6.6, and then this week, 5.2. So in total, there have been 22 million new jobless claims filed in the last 4 weeks. Give you some context for what that means. That's more than twice, the total number of jobless claims that were filed during the entirety of the financial crisis from 2008 to 2010. If you took every employee in Alabama and Arkansas and Georgia and Kentucky and Louisiana, Mississippi, North Carolina, Oklahoma, South Carolina, and Tennessee, if you added up all of the workers in all of those states and they all lost their jobs at once, that would be 22 million jobs. That's how significant what we're talking about has happened over the last 4 weeks. The Department of Commerce came out with their numbers for March retail sales. March retail sales fell 8.7% in March. That's the biggest drop in U.S. history. And certain sectors were hurt much, much worse even than that. So if you looked at the clothing industry and accessories industry, retail sales down 50% last month. If you looked at automobiles, if you look at bars and restaurants, retail sales down 25%, furniture down 25% in a single month's time. But that doesn't even tell the real story, because really the shelter-in-place orders didn't start until the last third of March. And so we're talking about some of these sectors of the economy seeing as much as 50% decline in sales month over month, really in 1/3 of a month. It's really incredible if you think about it. So a lot of the debate around, do we reopen the economy, do we not reopen the economy, has been like, well, you're going to put people's lives at risk, that you're ultimately going to make it so that people die. And nobody wants that to happen, right? Nobody wants to see the coronavirus spread in a way that ultimately kills more people. That's a bit of a straw man. But you need to recognize when we're talking about the economy that it's not just COVID-19 that has a health impact. The economy has an impact on people's health. Poverty literally kills people. The United Nations said as much this week in a report that they put out, that poverty was going to be responsible for lots of deaths as a result of what's happening with the coronavirus. And so if you want to think about it this way, for every 1% increase in unemployment, we were at 3.5% When this started, there are projections that we're going to get as high as 20%. JP Morgan has said that. There are some folks at the St. Louis Fed that have said as much as 32% is possible. So we're talking about an incredible short-term increase in unemployment. For every percentage point increase in unemployment, you have a 3.3% increase in overdose deaths. You have a 1% increase in suicides. And so you're talking about a considerable number of people that die out of desperation or acts of desperation for every percentage point that unemployment goes up. Now, this isn't speculation. This isn't a model. There is historical evidence for this. And so a waning economy has a profoundly negative impact, but it's not just the immediate deaths that you can count with suicides and things like overdoses. There have been a lot of studies done, and we talked about the Preston curve on Monday. It's this idea that as gross domestic product of a country goes down, longevity goes down. The number of years that people live goes down. And so this period of time in our economy absolutely will result in people dying, right? And there's substantial evidence to suggest that it could result in more people dying than COVID-19 itself. Now, I'm not suggesting that we have to decide between the economy and health. I'm suggesting that you have to balance the two and come up with solutions that sort of mitigate the risk and simultaneously recognize that there has to be economic activity. There absolutely has to be economic activity long term. Otherwise, we're putting ourselves in a position where more people are going to be sick, more people are going to die just because of the state of the economy. Now, why this sort of prelude to the real discussion we're about to have about reopening the economy? It's that every state is different, right? So depending on the situations in individual states, that's going to dictate what governors in those states should ultimately do. And so if you look at the big picture, what did we say? There were 662,000 confirmed cases of COVID-19 in the United States. Well, let's see. In New York, there are 233,699. So more than a third of all confirmed cases are located in the state of New York. And then in the state of New York, there were 14,405 deaths right before we came on. Out of 28,998 in the United States. So we're talking about more than half of all deaths in the United States came out of the state of New York. Well, by comparison, the median, if you took like sort of the middle ground, not an average, but the middle ground state, what you would see is an average number of cases of 3,800 confirmed cases and 129 deaths. So New York has 233,000 confirmed cases compared to the median state having 3,800. And they have 15,405 deaths compared to a median death range of 129. So you see there a huge disparity between what is the epicenter or the hot spot in this country and what is happening in large portions of our country that are more rural. And you know, certain governors have taken an awful lot of flack. There are 6 governors who decided not to issue shelter-in-place orders. 6 across the country. So you had Arkansas, Iowa, Nebraska, South Dakota, Utah, and Oklahoma. Utah and Oklahoma, there's some cities issued shelter-in-place orders, but the governor did not issue a shelter-in-place order. Notably, all 6 of those places are far below the median for confirmed cases and deaths. If you look at the worst performing state from a fatality perspective, it's Oklahoma. It had 3 deaths per 100,000 citizens. The state of New York has had 79 deaths per 100,000 citizens. And then if you look from there, Iowa had 2 deaths per 100,000 citizens. And then all the rest of the states that didn't issue shelter-in-place orders have had 1 or fewer than 1 deaths per 100,000 citizens. Now, I'm saying all this not to suggest that the people who have issued shelter-in-place orders are wrong or that they've done the wrong thing, but to suggest that states are not all the same. And so you have people in metropolitan areas who are experts making decisions based on their life experience, which is people being stacked on top of each other. And in that setting, density of population absolutely increases the spread of a virus like this. But what these folks don't recognize, is those of us who come from rural parts of the country, is that we've been actually doing a version of shelter in place or social distancing our whole lives, right? We may not have called it social distancing, but the fact is the interaction level is just different. We're not stacked on top of each other. It's not as transmissible in that environment. And so it's no wonder that a state like South Dakota or a state like Arkansas or a state like Utah that is a little bit more spread out isn't experiencing the same volume or anywhere near the same volume as even the averages. They're well below it, but they didn't issue shelter-in-place orders. So really, the point here is not to say that one way is better than another, but to say what President Trump acknowledged in his talk yesterday, which is every single state is differently situated. They've got different economic concerns, they've got different population concerns, they've got different proximity to one another, and that affects what kind of process is appropriate, both for addressing the current virus and then ultimately for reopening the economy. So want to dive deep, or dive in, maybe not quite as deep, to exactly what the president has proposed. Now, mind you, these are guidelines because he has recognized that he does not, in fact, have absolute power, that ultimately governors are going to have to make these decisions. I think that's the right recognition on his part. But what he's proposed is essentially a form of gatekeeping or gating criteria for 14 days. That you would, if you're a state, you'd look at three things for 14 days. You'd look at what are the symptoms that we're seeing? Are we seeing a steady, sort of persistent downward trajectory of symptoms that are associated with either the flu or COVID-19? And are we seeing a steady downward trajectory of the number of cases being identified for COVID-19, as sort of a percentage of the test, right? So the number of positive tests that are coming back are getting lower, or the raw number of cases is getting lower. Either one of those things have been recognized in the guidelines that have been put out. And then the third thing they want you to look at is, what does hospital capacity look like? And they want to do serological testing on hospital staff to get a picture of how many hospital staff have had the coronavirus or at risk of spreading the coronavirus. So really, there are three things that the White House has suggested that states look at. Have you had a 14-day decline in people showing up with symptoms that could be COVID symptoms? Have you had a 14-day decline in confirmed cases? And are your hospitals at a place where they have capacity? Now, this is an important one because you'll remember that the reason that we issue these shelter-in-place orders in the first place, we were already doing social distancing. We were already being told to wash our hands and not touch our face. Those are all good things. But the reason we did these shelter-in-place orders, the reasons we shut down non-essential businesses, I hate that, but the reason we shut down those non-essential businesses was that we wanted to flatten the curve. And flattening the curve wasn't about ending the virus or the spread of the virus. If anything, it was about stretching the spread of the virus, delaying it so you didn't have these big peaks that overwhelmed hospital capacity. And what we've seen now is about 109,000 hospital admissions, which is far lower than any of the models originally projected. And largely, there's not a capacity problem. Then there could be examples where there is, like in New York City, where they've had some capacity problems. But across the country, they're really not these capacity problems. To give you just a point of context, last year there were 36 million hospital admissions across this country. And so if you have sidelined all these elective surgeries, which they have, surgeries that can be put off have been sidelined, adding 109,000 admissions is not that much in the grand scheme of things. And if you look at the numbers from the last couple of years, what you basically average is about 36% of hospital beds were empty on any given day. So more than a third of hospital beds on any given day have been empty. And we've added over the course of the last month and a week, about 109,000 admissions. There's really not a capacity problem at this point. But that's the reason for that hospital sort of standard being part of the gatekeeping measures. And then from there, you go into three phases. The first phase is essentially, hey, look, vulnerable populations, people who are over the age of 65, people who have these comorbidities or immune problems, you're going to continue to shelter in place. And people need to respect your isolation, right? People don't need to be going to nursing homes. They need to be shut off. All of those things stay in effect for the first phase. People can return to work under the first phase, but are supposed to start social distancing. Businesses have been asked where people can telecommute and telework or work remotely to continue allowing that sort of thing. No big public gatherings under the first phase. Schools remain closed. Bars remain closed. There can be some elective surgeries, but only in outpatient centers. And so that's sort of what the first phase looks like. And so we're talking about 2 weeks essentially before you can enter phase one. And then once you're in phase one, if you don't have a rebound and you meet the criteria again, which is to say that you have the decline in symptoms and cases and hospitals still have capacity, then you move into phase two. Phase two, vulnerable populations still remain quarantined, still remain sort of sheltered in place, but you see a little bit more freedom in terms of public gatherings. No public gatherings over 50 are suggested versus in phase one, public gatherings over 10. And you see some loosening of other things around things like using large venues as long as they're practicing moderate social distancing, theaters, sporting events, that kind of thing. So that's all part of phase two. Elective surgeries can be done in hospital under phase two. And then the third phase really is what looks like a return to normalcy almost. And in order to get to that, you have to do another 2-week period with the same factors met. Decline in symptoms, decline in cases, continuing to have hospital capacity. And basically vulnerable populations can start to interact again. And then most of the social distancing rules are relaxed at that point. And so what they've laid out is essentially a 1.5 to 2 month long process, assuming that everything goes perfect, assuming that there are no rebounds. Now, we know from other instances of viruses that have spread that there probably are going to be some spikes, some rebound as a result of people interacting with each other again. The point of this process that we've been in, again, was to flatten the curve. It wasn't to kill the virus. And so we'll see how people adjust when that happens. But the way these phases have been designed is to sort of gradually reintroduce or restart the economy. And the beauty of it is that it gives real certainty around what is required to trigger the next step or the next phase. So you see Wall Street reacting pretty positively, and it's not because they think we're out of the woods. We're not. The economic effects of this are going to take a long time to overcome. The health effects of this are actually going to probably take longer to overcome than most people realize. But what it signals is a plan and some certainty that people can start preparing themselves for what the new normal looks like and what it looks like to resume the economy rolling. And that's a really, really positive thing. So I want to close with one note because I had a buddy today who told me that every time I post, he wants to get on an airplane bag because the news is always bad. I'm sorry, one. But, you know, if you think about the things that we as a country have dealt with over time, no, Frank, that is not a copy of the book that you're referring to. If you think about the things that we have dealt with over time as a country, we have always figured out a way to overcome adversity. We have always figured out a way to overcome adversity. You think about slavery, you think about the Civil War, you think about the Civil Rights era and all of the ugliness that was involved in that and all of the hostility and violence and oppression. You think about depressions and recessions. This country has always figured out a way to overcome those things, to strive towards higher ideals. And so we have an opportunity now with a remarkable challenge to overcome that challenge and emerge stronger. And I believe American workers are going to be sort of at the forefront of overcoming, right? We're also a nation of doers and a nation of innovators. And we see businesses all across the country starting to rise up and figure out ways to adapt their business model, ultimately to help in a time of need, to help their employees make it, to provide options and opportunities to their employees, and ultimately to find new ways to contribute to the health crisis. People changing their business to make ventilators and masks and all sorts of things that you can look at across our economy. You know, even before these shelter-in-place orders happened, a lot of employers had taken appropriate steps to protect their employees. They were allowing employees to telecommute and work remotely, and they were allowing for adjustment in their business model because they recognized that healthy employees were necessary to be successful. And I believe as we reopen the economy, as we let American workers and American businesses innovate again, that we're going to see an incredible renaissance in this country. We're going to see what the American worker can do. And so for all of the negative news that is out there, this sort of idea or plan to get things moving again is in a lot of ways pretty exciting because it's going to be neat to see how people react to new opportunities in our economy, neat to see how people react in ways to help other people out. And so that part to me is heartening in this entire difficult process. I hope this has been informative to you guys. I would welcome any feedback other than that from Frank Lee, who is quite the jokester. I don't think red wine, in fact, will prevent you from getting the coronavirus, although who knows, right? Test it out. All right, guys, have a great weekend. We'll do another version of this podcast on Monday. We'll switch it up a little bit. We'll be doing it from the Focused Policy page. So if you've gotten an invitation from me to like the Focused Policy page, please do so, and please be watching for the next installment of the podcast. Have a great weekend. Bye-bye.